All right, welcome back. We're talking about, again, motivational interviewing and physical rehabilitation with Brian, and we're going to talk now about one of the key ideas of motivational interviewing, and that's kind of deals with focus. If you will, there's a problem of abundance at times. There's so many things you could attend to, so many things you could focus upon, but you've only got a limited amount of time. So we really want to kind of prioritize what we do. That makes sense to you, or what are your thoughts?
Absolutely, yeah. That's a problem I think we run into, especially somebody, let's say they had a major trauma, maybe a car accident or something like that. There's so many things physically, mentally going on, but we only have so much time, and we need to prioritize and address what's most important to the patient or the client.
Yeah, excellent. And so what MI has come up with is that, if you will, the arc of focus. These are my words, but motivational interviewing calls them the 4 processes. So one is always engaging. So we want to engage our patients so that they feel connected, that they have a warm relationship, and they know that we're on the same team, if you will, moving forward. Mm-hmm. And then how do we do that? So one is this idea of getting to agreed upon goals, or what is the plan, or what are the goals they want to work on. So sometimes we've named that what land in our training program. And then there's like motivational interviewing, there's the idea of motivation, or the why. In fact, their why, like what's in it for them. Mm-hmm. So your motivation for helping someone move forward may be different than your patient's. MI's perspective is, if the patient can really kind of connect to their motivation, they're more likely to push through the difficult times, push through resistance, and take on some of those difficult steps.
Sure. Yeah. It sounds like if they own it and they know why they're doing it, then it makes it a lot easier instead of me just telling them to do it and they don't know why.
That's it. Spot on. And so then the question is, like, what can we do as providers to help our patients own it? And what do we not do? Like, there's some things to avoid so that we don't push them away from owning it. And then the other idea is this idea of how. So if we've got the goal, the motivation, then there's the steps or the verbs that the patient may need to take to get there. And then at some point we wrap it up. So like a story, every story has a beginning, a middle, and an end. There's a little bit of small talk, and we're not going to spend too much time there. In your world, if you spend 90% of your time in small talk, what do you call that?
Not billable.
Yeah, it's a waste of time. It might be friendly and interesting,
right,
but it's not as productive. And it's a professional topic, and so we need to be professional there. And then we're going to drop into what land, getting the goals, spending some time in why land, and jumping into how land. So stories have beginnings, middles, and ends, and then wrapping it up. Now what we've found is that a lot of times what MI is trying to address is that providers jump right into how land. They just start slinging ideas, telling people what to do, and maybe also telling them why to do it. Motivational interviewing has some key ideas to promote the client's engagement in this, and we'll talk about those now. Is that agreeable?
Yes, that's
all right. So we're going to do a role play, and we're going to demonstrate how we might go through some of these steps. Brian's going to be the patient, and then we're going to kind of walk through a few of these steps and stop and talk about what might fit or might not fit from your perspective. Does that sound agreeable?
Sounds good.
All right, so you're a patient. Tell me what it is give me a little bit of context in your background and why you're coming in.
Sure. I'll be in a subacute, maybe nursing facility, had a stroke, let's say a couple months ago. There's a lot of different things going on. I'm on a lot of medication, seeing a lot of maybe therapies and physical, occupational, speech, and so there's just a lot happening, and I'm a little overwhelmed by that.
All right. So then what we're going to do is, the first thing is to get to this idea of what land. And so let me share a skill with you, and then we'll demonstrate that skill. So the skill is this. So we're going to talk about, one thing is, patients often lead with concerns. And so a skill we're going to talk about is this idea of flipping concerns into goals. So Brian, there's 6 steps to this. So the first thing is, I just want to hear it. To say, oh, I heard what Brian said, that he's in a subacute rehabilitation center. There's a lot going on with medication, maybe some OT and physical therapy, speech therapy, so he's got to do a lot of things, and he's feeling overwhelmed. The second thing is, I want to hear the concerns, then I want to get to some empathy. Empathy always helps kind of build that relationship. And we don't spend too much time in empathy, because then it's just kind of wading through kind of the it's difficult to be me kind of an attitude.
Sad.
Yeah. So we honor it, and then we try to empower. So I want to, first of all, though, try to understand how could I get to empathy for this patient. The third thing is I want to flip it. So where are the problems, and how do we flip those to goals in my head? So those are all mental tasks. And then the sixth step, this can be a little bit flexible here, so we don't want to be too rigid, but I want to just repeat the patient's concern, just repeat it back. How do you think that would help your patients if I just say you're feeling overwhelmed because you've got a lot of going on with PT and OT and speech, and you're in a facility.
Yeah, you're listening. You understand what my concerns are. You're showing a little bit of empathy, and you're listening and you're hearing me. That's all.
So that's likely to promote engagement, or at least not turn people off, hopefully. And the fifth step, you already mentioned that, and this can be reversed, the 5 or 4 or 5, is offer some empathy. And then the next step is a simple request to work together on the problems. So then we're going to flip the concerns into a goal and propose that we work together on those. All right, so let's see it in action.
Okay.
So do you mind if you were repeating your concern and we'll go from there?
Ever since I had that stroke a few months ago, I just want to go home. I just gotta go home. I just want to be with my dogs, but they're kind of keeping me here. I have all these therapies that I have to do and these medications, and there's just a lot going on, and I just want to get home.
Yeah. Brian, you do have a lot going on, and strokes can be very difficult to recover from. You talked about they have you really busy in this facility trying to get better, and that can be overwhelming. And you want to be home with your dogs. You want to be just out of here. Mm-hmm. So maybe what our work together will be is for you and I to sit down and figure out what's your plan and how can you move forward. Would that be okay if we started there?
Yeah, if it gets me home. Sure.
All right. So we'll start on that level. So what we've done is we have arrived at a simple agreed upon goal. Now what we'll listen to from a motivational interviewing perspective is there's a lot of little skills. So what you might have heard there is some partnering language. Can we, together, let's. So that's not like you've got to do this, Brian, you need to do these things. But I'm talking as a partnership. Now, it doesn't mean that I'm going to do Brian's physical therapy. Like, he's still responsible for that. Like, can we talk about how you can do your physical therapy successfully?
Yeah, it feels like you're helping me.
That's right.
It's not just me doing it alone.
Yeah, and this idea of a credible plan really is going to kind of help lift that confidence, like, oh, someone will help me. You don't feel so isolated. Mm-hmm. And then often permission questions, would that be okay? And when Brian says yes, of course, right, then there isn't resistance between the two of us, like we're in collaboration. You maybe heard some reflections, some empathy, and empowerment. Another key skill in motivational interviewing is this idea of elicit, provide, elicit. And what I'm really trying to do is, rather than just provide Brian with the ideas, see what he already knows, and then use that as a starting point to build on, okay, Brian knows these things, I don't have to repeat those. Let me jump in an area where maybe he's less aware. Does that sound agreeable?
Agreeable.
Okay. So then, still talking about the high-level overview here, another skill might be like, hey, Brian, we know what you want to do. You want to kind of work on your physical therapy so you can get it out as soon as possible. Mm-hmm. Is that about right?
That's right, yeah.
Okay. So before we talk about how you could kind of be successful in physical therapy and OT and all those therapies, can we talk about why it's important for you to do these steps?
Yeah, I mentioned the dogs. They're pretty much alone. I have somebody watching them, but I can't see them. I love those dogs, and they miss me, I'm sure. And I've just been cooped up in these facilities, and I just want to get home.
Yeah. So now, from an MI perspective, there's two different types of language. There's something called change talk, which is language, desire, ability, reason, need, commitment, taking steps. Those are all types of language that suggest that Brian's going to do the work, that he's going to move forward. There's also another type of talk, which is sustained talk or resistance talk, which is the kind of yeah, but, I can't, I won't, or that pulls away from change. So now my job is to really try to encourage more and more of this change talk. So I want lots of green talk before I move over to how. So, Brian, so those dogs need you, And
They
so
do.
one reason to do these physical therapies is so that you can get back and take care of those dogs that you care a lot about.
I do. I want to do the therapies and everything, but sometimes I'm kind of tired, and I'm not sure if I can do it. It just seems like it's just so much, and it's overwhelming. I just want to give up. But then I think about going home and being able to watch the news like I used to, and just pet the dog. So I'm just conflicted. It's just really hard, the therapy and all these sheets that I have to, with exercises and everything, is just so overwhelming. Sometimes I just want to give up and just live here, and it's just, I don't know. It's hard.
So we notice there's both green talk and red talk there. So there's what's called a double-sided reflection. Talk about maybe 3 skills there. Name if you will, the conflict, and then talk a little bit about the red talk maybe first, so that we're honoring that, and then ending with that green talk so that it really helps him, again, find that motivation to kind of follow through with what's recommended. So I might say, I hear you, you're conflicted. It's not easy. You're often tired. It's challenging to do these therapies. And I also hear that deep down you really do want to go home and not stay here. You want to be home where you can have the freedom that you enjoyed, to be with the ones you love, including your dogs, and to just be out of this facility. Is that accurate?
Yeah, that's exactly how I feel. Yeah.
So let me ask you this. I'm curious about your motivation. So on a scale of 0 to 10, how motivated are you to actually take the steps needed to get through the program?
Maybe a 5.
5, all right.
Yeah.
It's not a 2.
No.
Why is it as high as a 5?
I love their little faces when I go and see them.
Right.
It makes me want to just continue on. I love doing it. I just love it.
You really care about your dogs,
I
and
do.
that's really important for you.
Yeah.
All right. So that's great. What else? Like, imagine this. Let's imagine you were to go 6 months out, and you've done the things needed to get back home. What would be 2 or 3 kind of benefits of that? What would be in it for you?
To being at home?
Yes.
It's also the freedom. I don't have people coming, therapists waking me up and having me do things. I don't have nurses coming in and doing that. And so I could just do what I like. Because I live out in the country, so I sort of live on my own and do my own thing. So being in here it's hard.
Right.
It's hard with all these people around.
And doing the things you need to kind of helps you connect back to your identity, to be out in the open, to be your own person,
Right.
and not to be constrained to this environment.
Right, my clothes, everything that's me. I feel like when I've been in these hospitals and everything, and I feel lost, and I'm almost getting unmotivated to. Yeah. It's just getting too hard.
I hear that. It certainly is challenging to be here over a prolonged amount of time. And like you mentioned, you'd love to be better so that you don't have people always harassing you to do these therapies like I'm doing.
Right.
So I'm wondering, is that enough motivation, for your dogs, for your freedom, access to, your place where you live, and not feeling kind of the press of this environment? Is that enough for us to talk about how you might actually succeed in your therapies?
I mean, now that you mention it, I tend to think about the negative a lot, and everything that's negative, like the food here and everything. But now that you put it that way, it actually it makes a lot of sense. I'm starting to think about the things that I really love, where I get distracted from that being in here.
Yeah.
So yeah, I think I'm looking to maybe see how I can go home and get there.
Okay. Well, if that's okay, let's talk a little bit about the steps you can take to help you get back home. Is that agreeable?
Yes.
Okay. So I'm going to freeze here. So if you're a case manager type, then that might be a referral to a different source. Or even if you're in medicine, you might say, oh, I'd like for you to talk to the OT or the PT or the speech therapist. That might be the how, is kind of linking people to other professionals. Or let's say that you're the OT, it might be like, okay, let's talk about the therapies that we're going to recommend from an OT perspective and how you can be successful. And so that's where we might pass off the